Hello, everybody. My name is Nick Wise, and today's presentation is about data sets and information management and what you, the practicing nurse, needs to know about this important information and how it impacts patient safety and quality of care. So first, we need to define what a data set is. And a data set is a collection of electronically compiled information grouped together to be used for the purpose of analysis. Data sets can be small or they can be very large. If the healthcare system compiling this data happens to be large, then the corresponding data they provide is going to be immense. This data can then be sorted through or mined for valuable information from a variety of sources and used to improve the care we provide. Ideally, those improvements are going to be to quality and safety, which we will discuss more later. The data can be used in other useful ways as well. It can be used for the purposes of education. It can also be used for communication with patient care devices, which can be interpreted by providers. It can be used to optimize care, and it can inform the financial aspects of an organization's functioning. Next, we're going to talk a little bit about some of the background of healthcare information technology, data sets, and information management, and how we went from the beginning to now. Back in the late 90s, 1996, the Healthcare Insurance Portability and Accountability Act, or HIPAA, was brought into being, and along with that came rules for the management and usage of healthcare data. The plan to start implementing how the electronic health record would roll out and function within healthcare also started around that time. For example, uh, healthcare uses electronic medical records such as Epic. If you're from Rochester, you've probably heard of that. So, how this would be implemented was in its infancy, in its early stages, back during this time. Later on down the road, for those of you again from Rochester, you may know this. Rochester Regional, well, back then known as Rochester General Hospital, implemented a version of Epic called Care Connect, which happened at about 2012. So it was fairly recent. It seems like a long ways away, but it wasn't that long ago. So this effort to establish electronic medical records, EHR, EMR, the administrative data that comes from these organizations and even their financial data, that stuff was being considered quite some time ago relative to where we are now. Here we have some examples of healthcare data sets. These are data sets where healthcare organizations are actually putting this data so that it can be used in the future. Some examples are Uniform Hospital Discharge Data Set, Uniform Ambulatory Care Data Set, the Minimum Data Set for Long-Term Care, Data Elements for Emergency Department Systems, Outcomes and Assessment Information Set, also known as OASIS, which we will discuss in greater detail, and the Health Plan Employer Data and Information Set. And as you can see from the names of these, they indicate where this data is coming from and can give you an idea of the kinds of things they're likely collecting and what it's being used for. Again, we're going to discuss what the Outcomes and Assessment Information Set actually is because it's a great practical example of how this is used in the real world and how it impacts patient safety, quality of care, and other aspects of the care that we provide from both a personal and a systems perspective. Next, we have some examples of real accessible healthcare data sets. These are places you can go to where this data from places such as the OASIS, let's say, is stored so that it can be interpreted. Some examples include healthdata.gov, data.gov, the World Health Organization, Human Mortality Database, data and tools of the National Center for Health Statistics, and Medicare.gov. Again, we're going to discuss Medicare.gov a little bit more. More specifically, we're going to discuss the Centers for Medicare and Medicaid Services as they play an important role in the OASIS data set that we discussed. So what does data have to do with quality and safety? In 2002, the Institute of Medicine, the IOM, held a summit to develop competencies to improve quality and safety. Some of these competencies include patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, safety, and informatics. These are all areas in which nurses need to be competency to provide the best care. The inclusion of informatics is important because healthcare IT provides nurses with a powerful tool to input and track data that's needed to improve quality of care and safety to their patients. And it's an important aspect of these competencies as well, because not only are these competencies something they want practicing nurses doing, but these are also things that they designed knowing that it would be important to include in the educational process of nurses as well. And the data that we collect, which is inputted by all manner of healthcare employees, nurses being the most abundant in the healthcare system, that data is collected from a variety of sources, whether it's patient care that we're providing, outcomes, financial data. And what they do with this is they then take it and review it, and they can see patterns and identify important aspects of that data that show them where their efforts need to be to improve the care we provide. So let's talk about a real world example of this so that it doesn't sound like generalities and vague ideas of what we need to discuss. So the OASIS, Outcomes and Assessment Information Set. This, if you've ever worked in healthcare before, this is well known to you. OASIS was created by the Centers for Medicare and Medicaid Services as a data set to compare a single patient at 2 points in time during their care. This is generally when they are admitted to a home care service and when they've hit the 60-day mark. And it also comes into play around acute issues that involve hospital stays or their discharge date. Primarily, though, you're looking at comparing when care started and when it ends. That's the ideal. And the purpose for this is to see what kind of outcomes they have, see if they're a desirable outcome while they've been receiving care in the home setting. This data set is very important in terms of patient safety and quality of care, but it's also important because it impacts the finances of home care organizations. So OASIS takes information from a patient who, let's say, was just discharged from the hospital with a CHF exacerbation, and it looks at aspects of their well-being, including their ability to tend to their activities of daily living, their safety within their home, their skin condition, among other things. And it has the nurse perform an assessment, which is part of their charting. And that assessment grades these patients on a scale of 1 to 5. 1 being that the patient is doing very poorly in whatever category is being measured. So let's say if it were their ability to get up and ambulate to the bathroom, a 1 would signify that that patient has no ability to do that on their own. They need 100% assistance. A 5 would be that the patient is entirely independent. And then what the nurse will do once they've collected the base data is check those each time they're making visits. And at the 60-day mark, let's say that's the discharge time, that data is going to be looked at again and compared with the original set. If the patient's doing better than they were when the nurse began working with them, then they are considered to have been successful in their outcomes. There's been an improvement there. This is a good thing for a variety of reasons. One, it tells us that they were given quality care, that their safety needs are being met. Obviously, very important. Another important aspect of this, and this is what goes on behind the scenes, is that this is going to dictate the reimbursement to home care organizations. So there's a financial layer to this as well, which really does impact patient safety and quality of care as well, because institutions that are financially healthy can provide better services. They can provide better staffing, better compensation, keep their employees happy, provide better equipment, and so on. All of these come into play in our patient care scenarios in one way or another, even if we're not aware of them. So this is the level to which these data sets can actually impact patient safety and quality of care. I was intrigued to see this come up in my research because this is something I have quite a bit of experience with from my time in the community. And I was excited to share that with everyone so that they could get an idea of the realistic application of what these data sets do. The downside of something like OASIS is that if you have a patient who is, let's say, in and out of the hospital frequently because they're not following their plan of care or they've had some major life change that has negatively impacted them and they're not meeting their outcomes, well, then that tells a different story. Now you have a patient who is not receiving good quality of care on paper. They're potentially unsafe because they've developed a pressure or ulcer, or they've lost their ability to ambulate or to dress themselves, or they've fallen and harmed themselves. And then what you see as a result of that is the organization of Medicare and Medicaid services taking away funding to these healthcare organizations, harming their ability to hire more staff and to make sure that they have the right number and amount of supplies that they can provide to their patients. So this really does have real world implications. And this is a great example of the kinds of things that you will see in your practice, especially if you're in the community. So I hope that everyone took a lot away from this. I certainly enjoyed going through that information and providing everyone with a real example of it. So take care, and I hope that you're able to take this knowledge and use it in your practice.